Could you tell me why you were referred to this office for your infant?
We were referred by the dentist, Dr. Gabelis, and he knew that she had a potential tongue and lip tie issue, so he wanted you to confirm those issues before he did the laser treatment on her.
And how old was your infant at the time?
She was 2.5 weeks old.
Okay, okay. So how was your nursing before the frenectomy?
Before, it was horrible. I dreadfully counted down the minutes until the next nursing period and tried to stretch them out as long as I could because it was just so painful. She wasn't able to effectively drain my breast. I was always engorged, and she gave me scabs and blisters, and I was pretty much on the brink of infection with those scabs.
Wow. Okay. So, could you tell us how many times you were recommended to come for treatment before and after the frenectomy, and what that entailed?
Before, he recommended that we see you once to confirm the issues. And then after the treatment, he and you both recommended 4 follow-up treatments to make sure that the wounds didn't heal and to continue the stretching of her mouth to make sure that it was nice and stretched out and working.
Okay. Were you taught exercises at home, stretching exercises for your baby to help with the wound healing?
Yes, we were taught the exercises. I was even able to videotape them on my phone, so I was able to look at them again when I got home to make sure that I was doing them correctly. So that was really helpful, and I felt pretty confident in doing them at home and was able to get through them without a problem.
Great. Were you also recommended to have craniosacral evaluation and craniosacral treatment for your infant by Kathy Matthias Riggs, physical therapist?
Yes, she came in and assessed Lila and determined that she did have a little bit of work that needed to be done because she was a little compacted or compressed in one area. So after that, we did some follow-up appointments with Kathy, and each appointment she was able to work on her, and in return Lila was more relaxed, was able to nurse better. I think it helped to loosen her up a little bit for nursing, like in the jaw area.
Could you describe your baby's temperament before and after these 3 sessions?
Yes.
With Kathy?
Before, her temperament, she was very concerned all the time, always had a furrowed brow. She was very stressed out and crying all the time, and we couldn't console her.
So what was her temperament after the 3 sessions with Kathy?
After each session, we could tell that she was gradually becoming more calm. She was also able to nurse a little bit better each time, and she was able to move her head better back and forth. Before, she was only able to move, she preferred only to move her head to the left, and afterwards she is moving to the left and the right.
Okay. So could you tell us what the end result of both the post-frenectomy care that you had here and also the craniosacral craniosacral treatment, what was the final result of Lila?
Final result is that she is nursing perfectly. We look forward to each nursing session now, and we're bonding. I'm able to bond with her instead of me being frustrated and her being frustrated. We can enjoy each other all the time, not just the times we're not nursing, and that she is a lot more calm. We can take her out in public and she's not freaking out all the time. She stays calm. We can console her, whereas before we couldn't get her to calm down. So it's a lot more enjoyable all around.
Would you say your child had colic symptoms? Would you call her having colicky?
I think so. Symptoms? Yeah, we were questioning if she did because we couldn't get her to calm down even at night. So now she's a lot easier.
And would you recommend this type of care for any colic child or any child that had issues with nursing?
Oh, definitely. Definitely. I think it's made her more focused, and then also with the frenectomy and following up with those exercises, it has gotten her to nurse a lot better and a lot more effectively. She just she can do what she needs to do now without any other distraction.
Wonderful. Thank you so much for coming.
You're welcome.